Now, with cancer rates continuing to rise around the world, doctors are looking at new ways to treat it and increase their patients' chance of returning to full health. Doctors say that immunotherapy has revolutionised the way that certain cancers are now treated. Some treatments help the immune system to slow or even stop the growth of cancer cells. Kate Jensen spoke with Dr. Julieta Zuluaga, a specialist in clinical hematology at the American Hospital Dubai, to find out exactly how it works.
There are mainly three types of blood cancers, roughly speaking. There's leukemias. There can be acute leukemia. There can be chronic leukemia. There are lymphomas, many types of different lymphomas, Hodgkin's and non-Hodgkin's lymphoma as well. And there's multiple myeloma. There is a specific type of blood cancer from the plasma cells.
And what are the symptoms that people need to look out for that indicate something should be wrong? When should they be going to the doctor or the hospital for advice?
So for lymphoma, there are three types of symptoms that we have to pay attention to. That is unintentional weight loss, an important weight loss, more than 10% of your body weight, night sweats, more than, even if it's hot, like severe night sweats, and fevers that are not related to an infection. For leukemia, there is nothing much that we can do other than if you visit a doctor and they see a very high or a very low white blood cell count, we have to suspect leukemia as well. For multiple myeloma, it's very common that the patient does complain of body aches, especially in the lower back pain, or severe body aches that do not improve the Panadol and that have specific lesions in the radiology examinations.
Okay, so I guess the key thing to remember is that if something doesn't feel quite right, it is important to go and see your doctor, go and get that real medical advice. Now, in terms of treatments available, we've heard a lot in the past about chemotherapy, but you say there's a lot of interest now in immunotherapy. So what exactly is that and how does it work?
So immunotherapy is a very evolving and promising new type of treatment that, differing from chemotherapy, it's a type of treatment that it engages your own immune system to help your body fight the cancer cells.
And how is the treatment offered? Is it a case of taking a pill each day? Do you come into the hospital for a longer stay? How exactly does it work?
So there are different ways of giving this type of treatment. So immunotherapy can either be given oral pills, daily oral pills. It can be given as an IV infusion, which could be done weekly or monthly or on a cycle basis, depending on the diagnosis and on the type of immunotherapy you're receiving. It can also be a subcutaneous or an intramuscular injection, so there are many different types of ways to administer this treatment. It can either be for a definite amount of time, like a predetermined amount of time, or it can be a long-term treatment as well. Immunotherapy is a novel treatment, and why would we choose it? Because combining with chemotherapy, it can boost the response the patient is having to the cancer treatment. So it can enhance the response and get better results, get better overall results. Another benefit that we can see with immunotherapy is that there are some types of cancer that don't respond well to chemotherapy alone. And we have seen that combining them or even sometimes treating them alone with immunotherapy does have a better result. As well, the side effects of immunotherapy are a different type of side effects from chemotherapy. It doesn't mean that it is free of side effects. There are some side effects. All medications do have side effects. But the profile of side effects of immunotherapy is less toxic, let's say, than chemotherapy.